Right. Hello, everyone, and welcome. We're so excited to welcome you today to our UltraClear webinar with Elevated Aesthetics. We have a great presentation prepared to educate you on our newest laser device. We'll explain how it works, what it treats, and why we're so excited. If you've been considering laser treatments or are curious about the latest advancements in aesthetic technology, today's session will give you a clear understanding about what makes UltraClear unique. We'll also reserve time at the end for a live Q&A with our wonderful speaker, Tara McLamb. So please drop your questions into the Q&A box right at the bottom of your Zoom screen as we go. If you experience any technical difficulties during the webinar, you can use the chat feature and I'll be here to support you. Be sure to stay with us through the end. We'll be sharing a special UltraClear promotion available exclusively for attendees. Before we get started, let me introduce you to our wonderful speaker. I'm pleased to introduce Tara McLamb. Tara is a board-certified nurse practitioner and has been an NP since 2010. She has trained extensively in advanced techniques and is proud to offer her patients expert care on a level that only a provider can provide. Her passion is educating her patients on how to achieve wellness well into old age and empowering them to be their own self-advocates. Her goal is to highlight the beauty that is naturally within each and every patient who sits in her chair. And now, Tara, if you'd like to take it away.
Thank you, Holly. And thank you guys so much for joining us tonight. I know you all have very busy schedules, and so just taking some time out of your schedule to hear me speak about this amazing new laser that we have brought on here at Elevated Aesthetics. What I love about the UltraClear laser is that it meets a need that we typically were not able to meet before we got this. When I got into aesthetics 4 years ago, it was really just to do Botox, as most of you guys know, and then it fell into this love of skin, and then that turned into some nice lasers. But we kept seeing these same issues over and over again, and that was really deep wrinkles, really deep pigment issues. And then we also had some issues with being able to only treat certain types of skin. So that's why I kind of went into a whole rabbit hole, and I really thought about getting CO2, but I had a colleague of mine who encouraged me to look into this cold fiber laser. I'd never heard of it before, and I thought, I don't know about this. This sounds a little bit like crazy stuff, but I started looking into it, went to a couple of laser conferences, and I was really impressed with it. So without further ado, I want to share with you why I'm so passionate about it. So you're going to watch this quick little video about the UltraClear Cold Ablative Fractional Fiber Laser.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs. Balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass. Delivering each pulse to the exact depth with precise timing. Minimizing risk and pain. Allowing faster healing with optimal results. Keeping patients safe from discomfort and side effects. Something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Very good. So that's a great introduction. And so let's move on to talk about who is a candidate for UltraClear. Basically everybody. That's the beauty of this. So it doesn't matter really what kind of concerns you have. UltraClear can answer the call for that. So overall skin rejuvenation is what we're really using it for, and especially those deeper wrinkles, but it also addresses just very fine lines, uneven skin tone, surgical scars, acne scars. So I'm really excited to show you later on some before and afters of our colleagues that have some really good before and afters, and also some of us that we've done ourselves here in just little old Eastern North Carolina. So these are the things about UltraClear that we love so much. The versatile treatment areas is one of my favorite things. It's because I can't use some of our other technology on areas off of the face, and we can with UltraClear. So a lot of times we ask, you know, other than the face, what do patients, how do they look old? And it's their neck, their décolleté, and their hands. And so I'm able to safely customize the treatments for those areas as well as other areas. We've already started using it on areas such as abdominal scars. I've used it on a Mohs surgery scar to help with that. So, and it's an all-in-one solution, meaning it really doesn't matter what your concern is. We can use it for basically anything. The other thing I really love about it, and it's probably my favorite feature of the UltraClear, is the comfort without compromise. So in the past with CO2 lasers, because that has been the gold standard forever for ablative lasers, is to get these incredible results, you had to have a social downtime of about 14 days or longer. And in my opinion, that's just not acceptable. We are all way too busy for that. No one has time for that kind of downtime. So you could either have decent results with very little downtime, or the opposite, great results, but incredibly long downtime. So in this situation, you have no compromising on the results, but you're still very comfortable with that. You'll see a video of someone receiving the treatment, just kind of how comfortable they seem to feel. So let's talk a quick minute about skin types. This is the Fitzpatrick skin type scale. And so all of us fall into anywhere between type 1 and type 6. So you can see types 1 through 3 are this kind of white skin, fair to beige, and any shades in between. And typically there are certain lasers that beyond type 3 are not safe for us to use. One of those is one of my favorite handpieces on our Nordless device, and we love it. It's called IPL, but it's not safe for types 4, 5, and 6. And so it was leaving out virtually half of the population that I could treat with patients. And so now we're able to treat patients who have darker skin tones. So patients of Asian origin, Hispanic, African American, Caribbean, all of these patients who are generally being left out. So it doesn't matter your skin type with the UltraClear laser, which I love having an ability to treat skin of color. So if you look at, and you may have seen this if you're following me at any amount of time, you've probably seen a diagram of the skin because I'm a nerd. But you can see the top layer is the stratum corneum, and that's where kind of the hair follicles are coming out. And then there's the epidermis, and that's the most outer layer of the skin, those two together. Below that is the dermis, and that's where all the magic happens. So that's where your fibroblasts live. That's where collagen is made. You can see that's where the blood vessels are is in the dermal layer. So a lot of times it's not only where the magic happens in the dermis, but that's also kind of where you start having problems. So whenever you are losing your collagen, it's usually in that dermal layer. Whenever you are having rosacea issues of those broken blood vessels, that's in the dermal layer. So melasma or hyperpigmentation is right there at that epidermal dermal junction, or where they meet together. So what we're seeing is that a lot of these lasers, non-ablative, they cannot reach down into that dermal layer very well. And so they do an okay job of maybe fine lines, but they're not able to address those deeper concerns. And so that's why UltraClear really kind of answers that need. These are 3 levels of treatment, kind of introduced, by the UltraClear group. And the first one is the superficial, and they call it the 3D Miracle. Miracle stands for mid-infrared ablative cold laser. So very fancy, cute term, but it really is quite impressive. My staff often not forget, but the treatment is so superficial and so easily tolerable that my staff often forget that it is actually still an ablative laser. The downtime is incredibly low, if any at all. And so it's very great. It's great for like photo aging, sunspots, pigment, uneven tone, skin tone, little textural issues. And just that overall kind of glow, that glass skin that we're all looking for, is found in the 3D Miracle. The next level of treatment is the moderate, and that's where we do some more moderate to maybe closer to advanced within that realm of clear, ultra, and ultra clear. Those three modes. And that, as you can see, addresses pretty much all of our concerns. The only thing that it doesn't really address with that is skin laxity, or that looseness of skin that we start to see. And that is addressed with the next step, which is the advanced, which is that customized combination of UltraClear and laser coring. So you will see that as we advance into the deeper, more advanced treatments, that the downtime does increase. The beauty of that, though, is that that downtime, it says 5 to 10 days for an advanced UltraClear customized laser coring treatment, is incredible. But the results you're receiving are CO2 type results, which typically are 14 to 21 days, but you're recovered in 5. So you'll see a couple of testimonials in a few minutes about what they thought about their recovery too. So I just like to point that out, because that's a huge advantage, because no one has time to sit around at the house for 14 days. So those are kind of your 3 levels of treatment. And real quick, just a nice review, I wanted to point out about why UltraClear is so special. As you can see, the very first point of this timeline is that in the early 90s, CO2 lasers were introduced, and they have been pretty much the gold standard, other than erbium YAG, as you can see, in the mid 90s for ablative lasers, up until December 2021, when UltraClear got FDA clearance. So you can see that it has been dominating the world, really, for ablative laser resurfacing for decades. And up until 2021, we really did not have another option. It was either non-ablative lasers that came out in the late 90s, or CO2. So you either got decent results or you got your face blasted off. So this has been a game changer, in my opinion. And you know us at Elevated Aesthetics, we are all about kind of really being on the cutting edge of technology. What's the latest, greatest thing, and knowing and being told by a well-esteemed colleague that CO2 is going to be almost obsolete in the next few years. It kind of changed my mind on a lot of things. So we're going to watch a video real quick, and I'll kind of walk you through what you're seeing here, because it looks a little bit confusing, but they're going to show you this kind of trademarked ability of this 3D IntelliPulse. And you can see that as it's going down, the laser's going down into the skin, you can see the red arrows and the blue arrows. So the red arrows are the actual treatment, the heat, the laser that's going into the skin. The blue arrows are indicative of a pause or a break in that laser treatment. It's allowing the skin to kind of come back to a more regular temperature before it's again heated with the laser treatment. And throughout this, you can see at the top of that, it says coagulation. That's a fancy laser term that you don't need to worry about, but just knowing that we can change those numbers to really be more of a customized need for you. So certain coagulation numbers means a little bit longer downtime, but bigger impact. This is a video that I'll walk you through on the actual experience that a patient kind of goes through, and you can see he's putting on these adhesive laser goggles. We use regular blackout goggles here at Elevated Aesthetics. You can see they have like a little vacuum there by her face, and we have our own here. And then you can see the little pattern that it's making on the skin. And what I like to point out is look how comfortable she looks as she's receiving an ablative laser treatment. She's probably received a little bit of topical numbing, but otherwise, look how comfortable she looks. She's not jumping off the table. She is not having to use Pronox, which is like kind of like nitrous laughing gas. None of that. She's just relaxed. And that's what we're finding with this laser. Their patients and us as well are very pleasantly surprised at just how comfortable it is. You can really see the pretty little dots that it leaves and those track marks, kind of look. But that's the laser doing its beautiful work. And so it's very satisfying to watch. So you see the little smoke coming off, that's actually the skin being resurfaced, and that's what's sucked into that vacuum so that it, doesn't float around the room. So that's one of the big things that you'll notice is that vacuum is running and it's kind of loud, but that's just to keep us and you safe. So just kind of satisfying to watch. It's like one of those pressure washing videos. All right, we're going to move on. So we asked a couple of our patients at Elevated Aesthetics to kind of give their experience with what they had and what they felt about it. So I'm going to let you watch. The first one is a lady who had the full ablative 5 to 10 day downtime treatment with the UltraClear and coring.
I had the UltraClear with the coring process done, and it was amazing results. I would do it all over again. The downtown was somewhere between 5 to 7 days, but it was so worth it, and I highly recommend this service. The level of pain was very minimum. I really didn't have any pain at all, but the heat was a little intensive right afterwards, but it was well worth the experience of doing that. And I would say within 5 to 7 days from me having the treatment, I was ready to see the world and very happy with my results as time has progressed.
So as you heard, the heat for her, and that's what we hear a lot of times is they're actually surprised at how much it doesn't really hurt during. It just feels like a major sunburn afterwards. And so we send you home with a fancy little fan, and we have all these instructions. And I asked Pam when she received that treatment if she felt that the downtime was worth the results, and she said, "Oh, absolutely." This is another patient testimonial.
Completely happy with how this turned out. I do feel like I got a fresh glow. My skin just kind of softened up around my eyes. That had some little tiny like fine lines I could see, and they just seemed to relax. I noticed that a little bit around my mouth as well. I was just really excited how refreshed I looked. I felt like I could just go with some tinted moisturizer instead of full makeup. That is what made me really happy.
In summer of that video, she received the 3D Miracle. So we are very appreciative of those two ladies kind of sharing their experience with us, and you're going to see some of their before and afters. So with that, we're going to go right into some before and after. So these are of the superficial treatments, the 0 to 3 days downtime, and that includes your 3D Miracle. They're going to show a little video here just to kind of overview of that lunchtime laser facial.
Introducing 3D Miracle, a 10-minute laser treatment that jumpstarts your skin's own natural renewal process. No discomfort, no downtime, dramatic results. It's safe for all skin tones. Visit 3dmiracle.com to learn more.
Okay, so there's Miss Summer. You can see her picture. And I want to point out with her is that she took her before picture in her car. Obviously, this was selfies she took of herself. And I love that. I love when patients send me pictures because they're excited about their progress. So this picture, if you can see, and you'll be able to see it better in the others, you can see what looks like little dry flakes on her before picture. And so In the next picture, when we go to the next slide, you'll be able to see it a little bit better. But this was, I think, the day after her 3D miracle. So this was, you know, immediately after. You can kind of see what it looks like to know what you're going to look like the next day. She's a nurse. She went right back to work. She didn't have any downtime. And then you can see this is only 2 weeks after her first treatment. She was so excited. She texted me and our nurse and said, "Oh my gosh, look at these results already." She was just, and these are both without any makeup. So you can see the glow, you can see the lifting of all that pigment and fine lines. And the next one, you can really see that improvement overall in the dyschromia. You can see in her after photos a couple of bruises. We had some injections that we did, but that makes no difference with her results. But really improved. If you can see the laugh lines on the second before and after picture, those little lines beside her mouth, you can just see the difference in that already. And really 3D Miracle is a very superficial laser treatment. It really doesn't go that deep. So you can see how it can address a lot of concerns with no downtime. And you just get this little flaky kind of thing that happens, and then it all just kind of goes away, and you really start to get that pretty little glow. So we were very pleased with her results. This is the 3D Miracle patient that we asked to come in and be a demo for us, because we really wanted to try to see patients with skin of color. It's a very important process for me to be able to address, because in general, these patients have not been able to get a lot of treatments. And so I wanted to bring one of our patients in that she trusted us, we trusted her. And I'm glad that she did, because her results are just insane. This is 1 month after one treatment of a 3D Miracle. And so this lady on her right cheek beforehand and on her forehead, you can see that she had some post-inflammatory hyperpigmentation. And that is just from acne scars over the years. And in just one treatment, they're almost completely gone. And the forehead much improved, the right cheek almost gone. You can also really appreciate the improvement in her glow overall. And you can really kind of even appreciate just the overall confidence in her eyes in this after picture. I just love that. And we're really thankful that she was trusting enough of us to be able to do that. So these are some before and afters of 3D Miracle with one of my colleagues, Dr. Eric Bernstein. I actually met him in Chicago at one of these major laser conferences, and was able to pick his brain. And he is brilliant, and he gets great results. And he uses 3D Miracle a lot. He loves the 3D Miracle aspect. So one of the godfathers of lasers. Another one by Dr. Bernstein. You can just see what I love about this before and after for him is that you can see in the before picture, this lady had a lot of undertones of pinks and reds, almost a little bit of a rosacea, perhaps just some photo aging. But I love how the 3D Miracle just addressed all of that after just one treatment. So that I love that part of it. Again, this looks like maybe a Fitzpatrick skin type 4 of a Mediterranean descent. So again, we're able to treat skin of color safely and pick up a lot of those textural abnormalities, underlying pinks and browns, and really get to a prettier even skin tone. I love this picture because we think of the neck as all the crepiness and stuff, but we actually get a lot of sun damage on our neck. So the 3D Miracle is able to kind of even out that skin and help with some fine lines as well. If we wanted to address her neck lines on that after, then we could go in and do some more invasive ultra or even some coring. This is on an Asian descent patient. And you can see that they were able to get a lot of pretty results with the clear mode, which is very similar to the 3D Miracle. Looks like they were able to address some of her scars, pigmentation, just a beautiful result, and in a safe way. This is a Fitzpatrick skin type 6 with Dr. Brian Beesman, also a phenomenal laser physician. somebody I really look up to. And I love these results. Again, it looks like one that we had done earlier with just addressing multiple issues with just one treatment. It looks like this one was post 3 treatments, and they undid a lot of damage in this pretty patient's face, and she has a gorgeous glow. This condition is called a seborrheic keratosis. So it's a benign condition, and as long as it's benign, we can laser it, basically. I will say one thing about seborrheic keratoses is that they are super difficult to get rid of. We have had very little luck with our non-ablative laser in getting these things to lift and fade. And so you can see how this we actually now have a treatment for SKs, which is really exciting. This is melasma. I struggle with melasma, as most of y'all probably know. Probably half of you guys have melasma, and we do have a whole melasma protocol at Elevated Aesthetics, but now we just have one more thing in our armamentarium to be able to fight melasma. And as you can see, 2 treatments, and that's 10 months after her 2nd treatment. So that's another thing. Melasma is a lifelong disorder, but I love that they are able to keep this patient in remission pretty much with her melasma. They probably have some of those topicals on board, and that's one thing that we do as well in our melasma protocol is we make sure that you're on the appropriate topicals, whether it's prescription, medical grade, or otherwise, to make sure that we keep your melasma at bay. But you really have to have a multimodal approach with melasma. And it used to be that laser was very low on the totem pole in treatment of melasma, but now we have things that we can use that are safe. So very exciting times for those of us with melasma. Again, another melasma patient. And this just shows that we can use it off of the face. You know, a lot of times when we think about what gives patients or your age away, they may look phenomenal in the face, but then it's their neck, their décolleté, and their hands. And so being able to treat off the face is really important to hide your age a little bit. So now we're going to go into the moderate level treatments. This is one of our Elevated Aesthetics patients, and she is thrilled with her results, as are we, and you can see why. So in the before picture, she was really bothered by kind of that leathery texture to her skin on her cheeks, and that extended up into her crow's feet. We had done several non-ablative laser treatments on this patient with decent results, and in the end, we would, I think, have all been satisfied, but we really wanted to try to offer her something a little bit more of an advanced treatment. So we tried the UltraClear on her, and as you can see, in just one treatment, 2 months after that first treatment, she had leaps and bounds improvement in her texture, her lines, not just fine lines, but deeper wrinkles. And so I really like to point out things like the nasolabial folds, those areas, and I'll kind of circle it so you can see right in here where it's just kind of crepey around that nasolabial fold. You can just see how it doesn't look crepey anymore. It looks healthy. Here, where it's just kind of deeper wrinkles, has just improved so much. She's got this glow about her. So UltraClear is going to be more of a downtime. She had about, I think she was really back to work around day 4, maybe day 3. She was still looking, you know, a little bit red and flaky, definitely flaky, slopping a little bit at day 3. So don't think that this is going to be your lunchtime laser and you're back to work. UltraClear is a little bit more intense, a little bit more downtime, but still very good results. We have been really, really pleased with her. In fact, this one patient texted me earlier this week, and she sent a selfie, and she said, "Please show Tara these pictures and tell her I said thank you." And so we love, again, we love for y'all to send us pictures and just reassure us that we're doing a good job for y'all. This is another patient that's not one of ours, but you can kind of see what just an ultra mode, which is not super, intense, can do just for the under eye area. So under eyes, around the mouth, the neck, those are the big three that everybody struggles with. And I love that we have an option now for around the eyes. Scars. So not only acne scars, which you'll see some before and afters in a few minutes, but surgical scars, traumatic scars, we can resection those, or resurface, I should say, with the Ultra mode. It's a slow process, but even with this, you can see just 2 months after 2 treatments, the improvement, not just in the texture of that scar, but also the color of that scar. It's come back to more of a flesh tone and not just this bright pink. So gorgeous result by Dr. Kilmer. I love this because it shows the UltraClear in all its glory and what it does, kind of like what we showed before with our patient, the improvement in, not just the uneven skin tone, but also some of those lines and wrinkles. And this is one of my favorite before and afters that UltraClear has. Dr. Brian Beesman is the one who gets the credit for these before and afters, but he is like the godfather of lasers. So I worship him just about, but he is an incredible physician, and you can see why. The good news is, though, is that UltraClear and the physicians that are kind of in that core group with UltraClear, they share their knowledge with us. And so all of their settings, they are just so giving, and they just say, this is what we've been using. This is what we're finding is working. And so they're reproducible results. So I've been able to get these kinds of results on my patients, in little old Goldsboro, North Carolina, that they're seeing in, larger cities. And there's no other technology like this anywhere near here. There's, Raleigh and Wilmington, and then there's us. So we're very excited about that. I really love here in this picture, you can see the improvement in these marionette lines. And you can see above that it says it's a customized treatment. That's what we do for every patient that comes in. Everything is customized. We want to make sure that we address all of your concerns, and then we marry these areas. So some of these places will only need a treatment of clear, like, maybe these pigmented areas just need clear. But some of these areas are going to need an UltraClear because it's going to need that deeper resurfacing. Men get lasers too. In fact, we're seeing this more and more, instead of Botox and fillers and all the things, is that they're really just wanting to look a little less tired and more rejuvenated. And so you can see this great result for the under eye as well. Some more customized UltraClear results, and really pretty. This area right here is really difficult to treat with anything other than laser. We really just can't get injectables in that area. Maybe some Radiesse, but it does not help that texture like a laser does. I mean, honestly, and I've never gotten anything close to an UltraClear result with anything else. This is an acne scar patient. This is life-changing. She's had one treatment, and you can see the difference in these, rolling scars that she had. Truly, this is just one of those things that gives your confidence back. So even if you don't struggle with acne scars, you may know someone who does, and this truly can be life-changing. Give them our information, because this UltraClear has specific guidelines that we can follow just for acne scars. So just incredible results. We can treat the neck, and obviously that's one of those things that before UltraClear, it was CO2, and the neck is extremely thin. So I always saw issues with the neck in terms of post CO2. I would see patients coming to me, and they had a lot of issues with that skin post CO2. And so really, before UltraClear, I had sent a bunch of patients out for a neck lift. And now I'm like, you know what? We really have another option now. So again, this is a Fitzpatrick type 4, treating safely with UltraClear for scars and pigmentation. This is a gorgeous result. This is 7 days after 2 treatments. What I like to point out in this kind of slide across the board is this is only 4 days after her first treatment. That's incredible downtime in terms of being able to just kind of bounce back to see that, you know, she really doesn't have, she has some residual redness, but nothing major. And then, you know, a week after her second treatment, look at that. That's incredible to me. Again, you know, you can tell by now that I love the UltraClear. It's safe for kids. Obviously, we don't do kids here at Elevated Aesthetics, but I wanted to keep this slide in there because if a child can handle it, you can totally handle it. It's really not that bad. Again, just beautiful results with Dr. Beesman with an UltraClear treatment, 5 weeks after 1 treatment. Typically, we would have used our non-ablative laser, the Nordless, with, you know, light and bright. And it would have taken at least 2 treatments of that to equal these results, whereas this is just 1 treatment of the UltraClear. Gorgeous. You can see this kind of, I know I'm not supposed to use the tightening word, but this improvement in the skin laxity here and here, and in the neck area. Just a great result. One of my favorites. Just that took 10 to 20 years off of her easily. That's an UltraClear. Now let's talk quickly about laser coring because I want to make sure that we're mindful of your time. Laser coring is one of the newer technologies, and what I can say about laser coring is that there is nothing else like it on the market. There is one that does mechanical coring, so it literally drills and sucks out the skin out of that one section. Pretty barbaric, very kind of a bloody mess. This is not that. So if you've heard of the mechanical coring, this is different. This is laser coring. So I think we have a video on this. Yep. So you can kind of see what is involved with laser coring. So it's going to kind of walk through a coring treatment, what it looks like. So you can see the laser goes into the skin, kind of makes these little holes, so to speak, but it's literally just ablating and vaporizing that skin. We can adjust, you know, how much of percentage of that skin is ablated, but down deep, you can see where it's making these little spiral type of 3D IntelliPulse technology for the coring. And over time, it forces that skin to come back together in a smoother fashion. So by doing that kind of more advanced injury to the skin, it's forcing your skin to create a little valley so it can come together. So this is the lady you saw with our video testimonial. And these are Elevated Aesthetics results. And we have been really, really thrilled with her results. She's been ecstatic. So you can see in the before picture, her biggest concern was always around her mouth and around her eyes. And it didn't matter how much Botox, whatever we put around her eyes, she always just had that little bit of crepiness. And so if you're finding that, like, you're getting Botox or Jeuveau or Xeomin, Dysport, whatever, around the crow's feet, and they're still just kind of crepey and they're never really better, a lot of times that's a skin integrity issue. Your skin thins out here very quickly, like around the neck. And so the only way to really improve that is to beef up that tissue. Now, we're not going to put filler here, right? So the next best thing is to get, well, really the only thing to really do there is to improve the collagen. And to improve the collagen is going to be an energy-based device. And in this case, we chose laser coring and UltraClear. We did a customized approach with the coring. We cored in different areas. And then we also did some UltraClear kind of just on top of the coring areas. So, of course, you can see the drastic improvement just 2 weeks after that first treatment. We were all excited. And then 6 weeks, just continued improvement. I actually saw her today as we took that video for the video testimonial, and she still looks great 3 months or so later. And the other places we did her neck. You can see that skin laxity just improving over time. It will continue to get better. So people often ask me, like, how often do I need to get these treatments? It's really going to vary. It's really going to vary on the amount of tissue we have to repair, how ablative we have to go, how, how your tissue heals, how it responds, and how well you're taking care of your skin after the treatment. So it really is going to vary, but it is going to continue to get better and better after a coring with UltraClear. We call this, we've branded it ourselves just to make it signature for Elevated Aesthetics. We call it the EA Ultimate Makeover, and or the EA Ultimate Eyes if we're just doing eyes, or things like that. So we do have certain packages, or I should say signature laser treatments that we've kind of put together if you're interested. But we've been really, really pleased with this lady's results as they continue to improve. You can appreciate the glow. I really even noticed, here she's got these like areas that are a little low, where we've gotten some fresh collagen, and that's, you can see the light reflecting off of her cheeks here, whereas they were not here. And this is, all three of these are without makeup. Obviously she has some eye makeup on, but she classically never wears makeup. And so this has been phenomenal for her to be able to go without makeup and to feel confident. This is another one of the Elevated Aesthetics patients that we love, and we have tried many, many things under this sweet lady's eyes to try to improve that crepiness in that little bag. And the only thing that has worked is the laser coring with a little bit of UltraClear. So we're ecstatic for her. So this was 6 weeks after just one treatment, and so we anticipate this to continue to get better and better with time. No further treatments needed right now. We're going to wait and see how this does, down the road. Not saying we won't do another, but right now she and I are both thrilled. It looks great. And it's just, it's an incredible thing to be able to offer to my patient an option that I can almost guarantee that it's going to do its job. So these are some other before and afters from Dr. Amy Peterson, and this, shows what coring can do in some of our younger patients, and this lady's probably in her 50s. But you can see how much it improved all of the things: her skin texture, her under eyes, around her mouth here, even her neck. Look at that neck. So again, coring is much more advanced, little longer downtime for sure. We do have pictures of patients in the immediate first few days. If you're ever interested, we can show those to you when you come in for your consultation to kind of see what the downtime actually looks like. I love coring for the neck. Traditionally, honestly, this is what sold me on the UltraClear, because the neck is such a difficult area. It's just been neck lift or nothing really up until this technology came about. So I love these results. This is realistic results because it's not a neck lift result. You can see that she still has some skin laxity here, but if you are open to surgery, more power to you. I have some excellent surgeons that I can send you to. But if you don't want surgery, then the laser coring is the way to go. It really helps with laxity. It's another example of what it can do. Look at these deep rhytids here, or deep wrinkles, I should call them, using some medical terminology, but some of those deep rhytids and that skin texture and the laxity are just drastically improved after one treatment 6 weeks later. This is another area that I really wanted to address and that I could not get improvement with any other device I had. And I hate putting filler into this area above the lips because it just makes people look puffy and unnatural. And so I went to a laser conference and I asked, he was the president of the American Society of Laser in Medicine. And I said, what are you using? and finding good results with for your perioral rhytids, your lines around the mouth. And he said, the only thing I've found to work is coring with UltraClear. And I said, okay. So my next step was looking up UltraClear reps in my area. Because, if he says it and he's used it with good results, then if it's good enough for him, it's good enough for us in North Carolina. And as you can see, this is 6 weeks after one treatment. I actually did a patient today. I've been doing them around the mouth lines for the last few weeks, been getting great results. So excited for my patient today to see how we've done. This is coring around the under eyes. You can see this patient's a little younger, but sometimes it does take just a little bit more of an advanced approach with these patients. Okay, and that takes me to the end of my presentation.
That was fantastic. Thank you so much. Those results are amazing. I cannot wait to get my treatment done. And special bonus for everybody that's tuning in with us tonight. We are offering 20% off your UltraClear treatment, but we want you to be quick and excited. So the first 5 of you that book your treatment after this webinar here will also receive complimentary 3D Miracle on your neck or your hands. So we saw what that does to your face and your neck. Like, that's a fantastic opportunity. So if everybody is ready to go ahead and book, I will pop that phone number also in the chat here, so you can easily copy and paste it. If you want to go ahead and text UltraClear to our phone number here, our team will be in touch with you to get your consultations booked and get you ready for your treatment. Now we'll go ahead and get into my favorite part of the evening, the Q&A. Awesome. We have a couple questions that have been popping in. So reminder, now is your chance. If you have any questions for Ms. Tara here, whether it's for UltraClear or anything else, please pop them into the Q&A box now and we'll start to address them. Yeah. Let's see. The first one that has come in, really good question. What does the aftercare treatment look like?
Oh, yeah, that is a great question. So we provide you with a little kit that is going to include your sterile saline gauze that you would do that night. And then the next day you start what we call vinegar soaks, and we tell you how to mix that and everything. We give you all the gauze for that. And then you will only use certain skincare products that we will provide to you complimentary. So you receive a restorative kit that includes the hyacin active mist spray and a restorative serum. Both are complimentary and very safe to use after ablative lasers. And then we also have some recommendations for a gentle cleanser and a gentle moisturizer. You would definitely not put anything other than that and Aquaphor on your face for the first couple of days. And then after day 2, you can start wearing some SPF on your face and be very, very careful about sun exposure. And after that, at around day 5, you're going to start feeling like you can use some of your actives again. We just discourage that for about a couple of weeks. A lot of people are like, oh, it's back to normal. Still, your skin is in healing mode. So we just tell everybody, wait on that, give it a couple weeks, let everything kind of regroup, and then you can start your actives back.
Fantastic. That sounds easy enough. Let's see. Would you recommend this over Light and Bright?
In certain situations, yes. You guys know I love my Light and Bright. We have used it for, I think, 2.5 years now, and it's just our bread and butter. We love it so much. But for those of us who have deeper wrinkles or skin laxity, that Light and Bright is just not going to get it, or it's going to require multiple treatments to approach that concern, whereas we can get it in one treatment with the UltraClear and laser coring. So in certain situations, I'm going to reach for my UltraClear before I reach for my Light and Bright.
Awesome. Let's see. And then how does this compare to CO2 or Halo?
Yeah, good question. So we say it's CO2 results, but without the CO2 downtime. And Halo is essentially the same. It's an ablative laser as well. And both of those are kind of hot topics right now on social media, TikTok, and all the things that, CO2 and halo. And while they're great treatments, they've been wonderful, and they still have a place in medical aesthetics. I think we have kind of hit this new horizon with ablative laser treatments, that we can use this new technology, cold fiber technology, that has less damage to the skin, and less downtime. And what I was finding with CO2, especially, is that I was getting patients back from sending them out for CO2 and getting them back, and they were having this prolonged erythema or redness that would last months and months after their CO2 because of the damage it had done. And we're really not seeing a lot of that with UltraClear. So it's essentially the same results as CO2, but with all the good parts, still retained.
Yes, love that. Let's see. How long do I have to stay out of the sun?
Also a good question. Being in Eastern North Carolina, we are always in the sun. So our rule of thumb is 2 weeks before and 2 weeks after. It would be ideal if you would stay out of the sun longer, but that is the minimum. And then even within that time frame or beyond, we want you to wear tinted sunscreen and a big floppy hat.
Perfect. Let's see. We have time for a couple more questions here. Can I do UltraClear and Botox on the same day?
I would not. I know that some people can, but because you're going to have some mild swelling or edema in your soft tissues from the treatment, unless we're only doing one area of that laser and then a separate area for your Botox, I would separate them out by a couple of weeks, just because you don't want your Botox spreading anywhere because of that edema. So I would space them out.
Perfect. And for 3D Miracle, how many treatments do you often recommend? Or can we do that as a maintenance plan?
Yeah. So the rule of thumb with 3D Miracle is, because it is superficial resurfacing, we say, depending on your concerns and what we're trying to correct, it may be one treatment, it may be 2 or 3. So with Summer, like you saw her video testimonial a while ago, she's only had 1. So come fall or winter, we'll probably do 1 more to kind of undo some of the summer damage and keep that on more of a maintenance approach. Then some people, if they have more dyschromia like rosacea, we may require more treatments. It really just kind of depends, but most of the time it's only 1 to 3.
Fantastic. Well, I think that's all the questions that we have today. So thank you, everybody, for attending. Thank you, Tara. I can't wait to see everybody in the office.
We can't wait either. And if anyone's interested in the treatment, we just recommend a consultation to let's make sure that we get the right treatment for you, and make sure that we're doing you the right service.
Yes, absolutely. And that phone number is in the chat. So everybody, if you want to go ahead and grab that, text UltraClear right to there. We'll go ahead and get you scheduled, and you'll be eligible for the promo.
Sounds
awesome.
great.
Thanks, everybody, for attending.
Thank you, guys.